Good evening, very good evening to one and all, my dear students, OET aspirants, those who are watching me, those who are on this virtual platform. I welcome you all on behalf of B-GHUD Academy. Okay, അപ്പോൾ നമ്മൾ പിന്നെയും B-GHUD അക്കാഡമിയുടെ നമ്മുടെ 31st ലൈവ് സെഷൻ ദിസ് വൺ ഈസ് സോ heartfelt welcome to all my dear students, those who wish to be abroad. So I wish you all good success. May all be there in your dream destinations by next year this time. Okay, അടുത്ത വർഷം ഇതുപോലെ സമയത്ത് ഈ കാണുന്നവരെല്ലാവരും അവരുടെ ഡ്രീം ഡെസ്റ്റിനേഷൻസിലേക്ക് ചെല്ലട്ടെ. ടങ് ടെസ്റ്റ് വരുന്നുണ്ട്. അപ്പം ഡ്രീം ഡെസ്റ്റിനേഷൻസിലേക്ക് ചെല്ലട്ടെ എന്ന് പ്രാർത്ഥിച്ചുകൊണ്ട് നമുക്ക് ഇന്നത്തെ സെഷൻസ് തുടങ്ങാം. ഓക്കെ, അപ്പോൾ നമ്മുടെ കഴിഞ്ഞ ദിവസത്തെ എക്സാമൊക്കെ കഴിഞ്ഞ് നല്ല ഫീഡ്ബാക്കാണ്. നമ്മളെടുത്ത ക്വസ്റ്റ്യൻ തന്നെയായിരുന്നു. ദറ്റ് മീൻസ് യൂഷ്വൽ ക്ലാസ്സുകളെടുത്ത ഒരു ക്വസ്റ്റ്യൻ്റെ ഒരു മോഡൽ തന്നെയാണ് വന്നതെന്ന് പറഞ്ഞു. സോ സ്റ്റുഡൻസ് ആർ ഫൈൻഡിങ് റിയലി വെരി ഹാപ്പി ആൻഡ് വി ആർ ബ്ലെസ്ഡ് വിത്ത് അബൻഡൻറ്റ് റിസൾട്ട്സ്. ഓക്കെ, നമുക്ക് നല്ല റിസൾട്ട്സ് കിട്ടുന്നുണ്ട്. നമ്മൾ എടുത്ത മോഡൽ ടോപ്പിക്ക് തന്നെയാണ് വന്നിരിക്കുന്നത്. നമ്മൾ എടുത്ത മോഡൽ ഓക്കെ അതേ ഒരു സ്റ്റൈലിലുള്ള ടോപ്പിക്കാണ് വന്നത്. സോ ഇറ്റ് വാസ് വെരി ഈസി ഫോർ ദം ടു ടോപ്പിക് സെയിം ടോപ്പിക് എന്നല്ല നമ്മൾ പറയാം, നമ്മൾ എടുത്ത് കൊടുക്കുന്ന മോഡലുകൾ പോലത്തെ ക്വസ്റ്റ്യൻസ് തന്നെയാണ് വരുന്നത്. അപ്പോൾ അതുകൊണ്ട് സ്റ്റുഡൻസിനൊക്കെ വളരെ എളുപ്പമായിരുന്നു ഡീൽ ചെയ്യാൻ. ദേ വെർ വെരി കംഫർട്ടബിൾ ഇൻ ഹാൻഡ്ലിങ് ഓൾ ദോസ് തിങ്സ് വിത്ത് സ്പീക്കിംഗ് ടെസ്റ്റ്. ഓക്കെ, അപ്പോൾ നമുക്ക് നല്ല റിസൾട്ട്സും ഉണ്ടായി. ഇപ്പോഴും വി ആർ വെരി ബ്ലെസ്ഡ് ടു ഹാവ് സച്ച് ആൻ അബൻഡൻറ്റ് റിസൾട്ട്സ്, മാസീവ് റിസൾട്ട്സ് എന്ന് വേണമെങ്കിൽ പറയാം. അപ്പോൾ എല്ലാവരെയും വെൽക്കം ദോസ് ഹു വിഷ് ടു ജോയിൻ OET കോഴ്സ്. Can come and join and can get good results and fly to your dream destinations. Okay, അപ്പോൾ നമുക്കിന്ന് തുടങ്ങാം. നമ്മുടെ സ്റ്റുഡൻസിൻ്റെ കൺസേൺസും ഒക്കെ നമ്മൾ അഡ്രസ്സ് ചെയ്യുന്നുണ്ട്. സോ ഇഫ് യു ഹാവ് ഗോട്ട് എനി ക്വയറീസ് ഓർ കൺസേൺസ്, നിങ്ങൾക്ക് എന്ത് വിഷമമോ എന്ത് ഡൗട്ട്സ് ഉണ്ടെങ്കിലും പ്ലീസ് ടു പുട്ട് ഇറ്റ് ഇൻ മൈ നോട്ടീസ്. യു കുഡ് ഐദർ റൈറ്റ് എസ് എ കമൻറ്റ്, യു കുഡ് ഇൻട്രാക്ട് വിത്ത് മീ, ഓക്കെ, പിൻ യുവർ സജഷൻസ്, ഓക്കെ, ആൻഡ് യു കുഡ് കമൻറ്റ് ഓൺ ദിസ് കമൻറ്റ് ബോക്സ്, ഫൈൻ, and you can give me encouragement through your words. Okay, I want all of you to be there with me so that it will be a piece of appreciation and encouragement for me to interact very well. Okay, അപ്പോൾ നിങ്ങൾ കൂടെ ഉണ്ടെന്നുള്ളൊരു വിശ്വാസം ഉണ്ടെങ്കിൽ I'll be very happy. I'll be feeling high level confidence in dealing with this task. അപ്പോൾ നമ്മൾ ഇനി സമയമൊന്നും കളയുന്നില്ല. ആരും ഇത്തവണ കൺസേൺസ് ഒന്നും അയച്ചു തന്നിട്ടില്ല. അപ്പോൾ അതുകൊണ്ട് എന്ത് ചെയ്യാം, വിൽ ഡയറക്ട്ലി മൂവ് ഓൺ ടു ദ ടോപ്പിക്. അപ്പോൾ നമ്മൾ ടോപ്പിക് ഡിസ്കഷനിലേക്ക് തന്നെ പോവാണ്. Hi my dear students, those who are watching me, just get me some salutations you could get me, either some hi or good morning or whatever it is. If it is there, means I'll be able to interact you freely. I'm not going to ask you any questions, instead you can throw me questions. Okay, so this is a live platform session. Don't worry about all those things that I'll be asking you questions. No, it's not time or it's not a correct venue for throwing questions. You could throw me questions so that I'll be able to correct it for you. I'll be able to deal it perfectly for you. Okay, so now I would like to thank to my gang, my dear Akash and Jobin, Vipin, all of them for making this session possible. It's because of their immense support and their guidance we are making it possible. All this virtual platform, I'll be only taking class, that is what I could do. I'm not a techno savvy, I'm not really into this technical aspects, and also my big salute to all my dear colleagues, those who are watching there, those who are just monitoring me and making this session possible, sitting there to my side. Okay, അപ്പോൾ എൻ്റെ സൈഡിൽ അവിടെ ഇരുന്ന് അവരും ആനന്ദപുളകിതരാകുന്നുണ്ട്. So our salutations on behalf of you also. I'm just extending my heartfelt thanks to my dear guys. Okay, അപ്പോൾ നമ്മളിപ്പം questions ഇടാൻ പോവുകയാണ്. Jobin, please. You can have a look onto the question and can read that. After that we'll go for discussion, and any doubts means you can just get back to me. Yes, the question is right there. All of you just take some seconds. Hi Loni, hello, how are you? I hope you're doing good. Hello all. Yes, I'm seeing many. Hello Lakshmi, hello Ansi. Hi Ravi, hello. Hello all of you. Yes, I'm very happy that you people all are watching me. Thank you for your encouragement and support. Yes, the question is right there. You can go and watch, you can see and watch the thing. Okay, so after 1 minute I'll be elaborating these questions for you and we'll discuss. ഈ സെയിം മോഡൽ ക്വസ്റ്റ്യൻ ആണ് വരുന്നത്. This, when it comes to these questions, I would like to tell you that the sort of models that we are taking, you could expect the sort of model topics. Okay, you can learn, because whatever you're practicing, the same sort of model will be coming, the same structure of topic will be coming for exam. Okay, so you'll be, I'm very happy that once after your sheer perseverance, your coaching now, you'll be able to deal with all those topics, and especially those sort of model topics that we are taking. Okay, yes, you can expect the same sort of questions, same model questions. Fine. Okay, this week also we are getting those sort of things, and for our students, they are finding it very easy to deal with their questions, because they have just done their practice, they have worked a lot, hard work, perseverance and all. So they all were capable enough to deal with those topics. Okay, now let's come on to the question. Okay, setting is a hospital ward. Setting is a hospital ward. You are checking on a 48-year-old patient who has developed osteomyelitis. That means a bone infection in his or her leg. Okay, so hospital ward, osteomyelitis is the diagnosis. Now we are dealing with the patient. Okay. Explain your role, why we are there. General inquiry, general well-being, our role we can explain, because we are there to monitor wound, vital signs and check IV drip. That is what our purpose is. Find out how the patient is feeling. So we should ask them how they are feeling. Okay, describe the symptoms of osteomyelitis. So the patient would be expressing some things, so we can just describe them, the symptoms. Reassure the patient about progress, some sort of progress we have observed in the patient, so that also we can state that and can reassure the patient. Okay, yes, because reduction in fever we have observed, that is a positive effect of antibiotics, that we should state and deal with the patient. Okay, find out more details about the pain. So the patient would be verbalizing pain, we need to collect more information on pain. Okay, give reasons for exploring changes in pain. So that means we need to ask more questions on pain. By the time the patient would be asking us, why nurse, why are you so curious in assessing my pain, why are you keen in assessing pain, they will be throwing the question. So we should explain them why we are asking more on pain. That means in the bracket it is giving like importance for monitoring possible sign of secondary infection. That means any chance of secondary infection can only be ruled out if the pain is assessed properly. Pain ശരിക്ക് മനസ്സിലാക്കിയാൽ മാത്രമേ സെക്കൻഡറി ഇൻഫെക്ഷൻ അല്ലെങ്കിൽ ഹയർ കോംപ്ലിക്കേഷൻസിലേക്ക് പോകുന്നുണ്ടോ എന്ന് നമുക്ക് മനസ്സിലാവുകയുള്ളൂ. All of you advise the patient to communicate any changes. So for that reason we have to strongly request the patient, advise the patient to report any changes while in pain. Okay, find out if the patient has any other concerns. So we should ask about their other concerns. Okay, explain treatment stages before discharge. So they will be asking about discharge. We should explain them. We have to make them know what are all the stages or what are all the criteria to have a discharge. Okay, that means controlling infection. Okay, infection should be controlled, switch to oral antibiotics. So now IV infusion is there, it will be converted to oral antibiotics. Establish self medication routine. After that, when the patient establishes self medication routine, that means tablets, oral tablets and all, at that time they can go for discharge. That is what the thing is. Okay, next one is like describe antibiotic treatment plan. So they will be asking you more about antibiotic treatment, IV infusion and all. We have to explain that. Okay, that means several more days IV. So for more days IV will be continued. 4 to 6 weeks tablet at home. Oral tablets will, they have to continue oral tablets for another 4 to 6 weeks. Okay, so this is what the schedule of antibiotic. Fine. Establish the patient willingness to do necessary checks. So finally we should ask the patient, once after getting the patient convinced, okay, once after making patient comfortable, calm and convinced, we need to we can ask them for the a further proceedings. That means we can ask permission, we can take consent for our clinical checks, and also that is what the topic is. This was an exam question. This was an exam question. So all of you can read this well, can prepare this well, so you will be able to deal any model of questions that is like this. Okay, അപ്പോൾ ഇതുപോലത്തെ ക്വസ്റ്റ്യൻസ് നിങ്ങൾ നന്നായിട്ട് പ്രാക്ടീസ് ചെയ്യുക, വർക്കൗട്ട് ചെയ്യുക. അപ്പോൾ ഇതുപോലത്തെയൊക്കെ ചോദ്യങ്ങൾ ചോദിച്ചു കഴിഞ്ഞാൽ മക്കളെ ഡെഫിനറ്റ്ലി വിൽ ബി ഏബിൾ ടു ഡു യുവർ ബെസ്റ്റ്. അപ്പോൾ നിങ്ങൾക്ക് ഏറ്റവും നല്ല ബെസ്റ്റ് ചെയ്യാൻ തന്നെ പറ്റും. So once again you can read that. Any sort of doubts or concerns means you can put it into my notice, you could comment over there, can pin your suggestions over there. Okay, so please do read once more. Any sort of comments or any concerns you want means, any concerns you have means, get it to me, I'll try to clarify it for you. Yes, please take another 1 more minute, after that we'll go for discussion. Yes. Okay. I hope all are okay with the question. Any doubts, any sort of concerns, any queries, anything doubtful regarding the questions means please come and tell to me. Unmute. Okay, so Luni has thrown me a question: how to practice speaking module? Is there any sites? Speaking module in the sense you can just take the topics. Okay, so for you, when you are asking me, you can take our practicing topics. You can just, this is our 31st session, Loni. So you can just watch all our previous questions. You can take that and can practice by self. So, and after your practice, you can record it and keep it on a side, and you can watch my narrations. Okay, you can just compare it with that. If you need any more clarifications, or if you need any more improvisations, you can just take those hints of points, the style of speaking, the intonation, everything you can make and can go for your practice. So this is the best way that I can suggest you now. There are plenty and plenty of questions available. So if you join our session, we'll be giving you extra more knowledge, more curious form of questions. Okay, more better form of questions that will be able to deal with. Okay, so you can come through any sort of question. So we have got abundant test materials we'll be giving you. Also, we are just taking all these models exam questions to make you learn how to practice by self. Okay, so whenever you go, this is our 31st session, that means 31 questions are available. You can take that before watching the narration. You can just practice by self, record it and keep aside. Okay, after that you can practice. Okay, you can just listen to my version or our version, and you can go for necessary improvisations or necessary modifications you can do. That is what. Okay, so plenty of topics are available. Fine. I hope that's clear. Yes. Shall I move on to this topic? Okay. Yes. So now we are going to start this topic. So how a productive, a very good introduction you can give this, rather than this usual sort of normal sort of our regular introduction. Good morning, I'm Abhilash, we are the listeners, will be taking care of it. Instead of that, what you can do here is, so the same sort of thing, because this is a known case. There is no doubt about it. This is a known case. Patient is known to us because he or she has been admitted to our unit for past few days. Osteomyelitis is the complaint. Okay. So now we are going to Loni, thank you so much for throwing me these questions, because now you are just actively participating in the session. So my prayers, all my dear best wishes, all my best wishes to my dear student Loni, because you are making this session more and more active. Thank you for interacting. God bless you. Do your best and get to your dream country. Okay, by next year this time, let you be there in your dream destination. God bless you. All the best. Okay. So Loni ആയിരുന്നു ഏറ്റവും നന്നായിട്ട് ഇൻട്രാക്ട് ചെയ്തുകൊണ്ടിരുന്ന ഇത് സെഷനിൽ. Yes. So now how can we go for an introduction? Yes. So as usual, known case, you can start this. You can introduce. The name is, you can collect the name during the third time. The 3 minutes, you can collect the name during that 3 minutes. This is a known case. There is no doubt about it. The patient is well known to us. Now we are going to start the introduction. How we can start an introduction? Yes. Now I'm going to say that because I cannot wait for your Bonnie. Hi, good evening, Bonnie. I was just waiting for Bonnie. I was just wondering where Bonnie has gone, because Bonnie was always the first one to encourage me, always the first one to make me feel that I'm not sitting in a forest, because usually I used to call many a time for all my dear students. But Bonnie, whenever he is there, he will be always coming and saying me a good evening, a hi, bye, and also I used to feel very comfortable when Bonnie is here. Okay, Bonnie, God bless you. Thank you for coming and joining. Yes. അപ്പോൾ നമുക്ക് how to start this topic. അപ്പോൾ നമുക്ക് എങ്ങനെ തുടങ്ങാം ഇത്? Okay, what is the best beautiful introduction that you can give to this topic? Okay, so many things are given there. So it is very tough to make sentences all of a sudden with all these things. Okay, that sounds like something by-hearted. I don't want all of you to go for some by-hearted or mugged up version, spoon-fed version. There is nothing like that. You should feel all those words that should come from your mind. Okay, അപ്പോൾ നമ്മുടെ മനസ്സിൽ നിന്ന് പറയണം. Intonation should be there. Intonation is what your speaking is. Okay, speaking എന്ന് പറഞ്ഞാൽ എന്താണ്? Intonation ആണ്. Ups and downs, space, pause, stuttering, stammering, everything is that makes speaking. Fine. മൂളാൻ ഞരങ്ങാൻ നിർത്താം അല്ലേ? മൂളണം, ഞരങ്ങണം, നിർത്തണം. യെസ്, ദീസ് ആർ ഓൾ ദ ക്രൈറ്റീരിയസ് ഫോർ എ വെരി ഗുഡ് സ്പീക്കിംഗ്. പക്ഷെ അതൊന്നും ഓവർ ആവരുത്. So how can we start this? So our role, we are going to deal with the patient non-case. Good morning Mr. Patrick. I'm Abhilash. I'll be working with you today. I'm your nurse. I'll be working with you today. So this is an introduction that you can give to your patient. Okay, good morning Mr. Patrick. I'm Abhilash, the nurse working. I'll be here with you today. Okay, I'm here for your care. I'll be here with you today. I'll be working with you today. Okay, I'm here to have a look onto your wound, IV drip and vital signs. Okay, I'm here to have a look onto your wound. Okay, I'm here to have a look onto your wound, vital signs and intravenous drip. Okay, and to monitor your intravenous drip. I'm here to have a look onto your intravenous drip, wound and vital signs. I'm here to have a look onto your vital signs, wound and intravenous drip. Hope you're doing well. Are you feeling better after coming to hospital? Hope you're doing well. You're feeling better after coming to hospital. So this is the introduction that you can give to your patient. Good morning Mr. Patrick. I'm Abhilash. I'll be working with you today. I'm the nurse. I'll be working with you today. Okay. How are you feeling? Okay, I'm here to have a look onto your wound. I'm here to see how you're feeling. I need to have a look. I'm here to see how you're feeling. How's your wound? Okay, and intravenous drip, vital signs. I need to monitor all those things. Whatever that comes to you in natural way, you can take that. Okay, that is what, but intonation should be there. Okay, I need to have a look onto your wound, vital signs and intravenous drip. How are you feeling? Hope you're feeling more comfortable. You're feeling better and you're feeling more better after coming to hospital, right? You're feeling more better. Okay, you're feeling more comfortable after coming to hospital, right? So this is how we are beginning the topic and we are giving a beautiful introduction. Yes, all of you. Fine. Yes, so the patient will be saying like, oh nurse, I'm okay, but my fever has, I feel like fever has reduced to an extent, but still the pain is there, nurse. That is what I feel like. Fever is okay, I think it has come down, but when it comes to pain, it is still there. So the patient would be saying like that. So describe the symptoms of osteomyelitis. We need to catch that. Yes, I understand. Yes, I understand. I know what you're saying. See, you don't have to worry about pain or fever. These are usual manifestations of osteomyelitis. Okay, these are usual manifestations of osteomyelitis. When you watch my video, you can write it and can practice by yourself. Yes, I can understand. See, you don't have to worry about pain and you don't have to worry about pain and fever. These are usual manifestations of osteomyelitis. And see, you have to be happy, stay positive, because it shows the treatment is working well. You have to stay positive, you be positive, you stay positive, be optimistic, because it shows the treatment is running well. Okay, the treatment is going on very well. Your fever has come down. See, as you yourself has told, your fever has come down. The fever has come down. It's an advantage of, it's a benefit of antibiotic therapy. See, as you yourself told, okay, has told, your fever has come down. The fever has come down. That shows efficacy of antibiotic treatment. Okay, that shows efficiency of antibiotic treatment. So eventually the pain will also come down. Eventually, okay, the pain will also come down. Okay, so these are the positive effects of treatment. These are the positive effects of treatment. So patient will be saying like, yes, nurse, I'm getting that. Well, by the way you told me that, you have pain. Can I ask you a few more questions on pain? Can I ask you a few more questions on pain, if I may? Okay, so the patient will be saying like, okay nurse, you please tell me about, you can ask me about pain. Okay, the patient will be saying like, you can ask me about pain. Can you please locate your pain? Okay, can you please locate me your pain? Actually, where do you feel pain? Can you please locate it? Okay, where do you feel pain? Actually, where do you feel pain? Can you please locate it? Okay, so the first, okay, how severe is it? Any change, do you experience any pain? I mean, how is the severity? Is it mild, moderate or extreme? So do you feel any change in pain? Okay, do you observe any change in pain? I mean, the severity I'm asking, is it mild, moderate or extreme? Is it mild, moderate or extreme. So this is how we are asking. Okay. Did you notice any new pain? Okay. Rather than this usual pain, do you notice any other pain, or do you notice any other pain? Is there any new pain that you have noticed? Is there any new pain? Okay. Any new site that you have noticed recently when it comes to pain? Did you notice any new pain? Is there any new site where you have pain? Where do you feel pain? Is there any new site? Is there anywhere else where you feel pain for the first time? Is there anywhere else in your body where you feel the pain for first time? Okay, or do you notice any new pain? Is there any change in pain? Okay, all these things we are just asking. So the patient will be, okay, does it occur all of the time regarding throughout pain? Does it occur all of the time, or every now and again, or just now and then? Does it occur all of the time, the continuity of pain? Okay, whether it is a consistent, or instead of on and off and all, we can just ask like, does it occur all of the time, or just now and then, or now and again? We are just asking them. So the patient will be answering, and they will be asking, "Oh nurse, you are just asking me more on pain. What is this? Instead of giving some medicines, why are you asking me more on pain? Why are you so keen in assessing pain?" So, okay. Beulah, very good evening, Beulah. Thank you for watching. Thank you for joining. God bless you. Yes, so the patient will be asking like, why nurse? Why are you asking me more on pain? Okay, why are you so keen in assessing my pain? So the patient will throw a question like that. So we need to give the third task, give reasons for exploring changes in pain. Okay. Yes, I know that you are online student. Thank you for watching. Thank you for supporting. God bless you, my dear student Beulah. Okay, so I'm very happy that all my dear students are watching me. Fine. Yes. So we need to say why we are so curious in assessing pain. What is the reason behind our exploring pain? Yes, I understand. I understand what you're saying. I understand, or oh, that is the matter. Oh, no, normal we can change as like, why nurse? Why you're asking me? Oh, that's the matter. You don't have to worry. See, now pain monitoring is very important. See, now pain monitoring is very important in your case. It is indeed very important to assess pain. It is indeed very important to assess pain, because pain gives a status of your health condition. Okay, pain gives a status of your infection, your health condition. We will be able to find out the risk of secondary infection only if the pain is assessed properly. We will be able to find out the risk of, or any ascending infection or second, we will be able to find out the risk. We will be able to assess the risk of, we will be able to assess the risk of secondary infection or ascending infection only if the pain is assessed properly. Only if the pain is assessed properly. Okay, so I strongly request you, I strongly advise you to report even a minor change in your pain status. So now I strongly request, like I strongly advise you to report, okay, or to verbalize any, even a minor change in your pain that you experience, even a minor change in pain that you experience. Okay, a minor change in your minor change in your pain that you experience. Okay, will you do that? Will you do that? So the patient will be saying like, sure nurse, I will do that. Thank you. Glad to hear that. Well, tell me, do you have any other concerns? Is there anything else that is bothering you? Well, tell me, do you have any other concerns? Is there anything else that is bothering you? Is there anything else that is bothering you? We are just asking the patient. So the patient will be saying like, when I'll be having this discharge, nurse, when I can go back home, nurse? Okay, please tell me that. We can say like, I cannot tell you that for sure. I'm sorry. I cannot tell you that for sure. I'm sorry. Okay, Patrick, I cannot tell you that for sure. I cannot tell you that for sure. I'm sorry, because that is not okay. One thing I could tell you, that your discharge will be advised only when the infection gets controlled. Okay, one thing is certain, or one thing is sure, that your discharge, okay, one thing about your discharge is sure, that you will be getting discharge only if the infection gets controlled. Okay, one thing is sure about discharge, that doctors will, okay, one thing that is sure about discharge is that you will only get discharge once your infection gets controlled, or once the infection gets controlled, you will be allowed to go home, you will be allowed to have the discharge. Okay, so it is very necessary to continue antibiotic therapy. Okay, so now antibiotic therapy, intravenous infusion is going on, IV antibiotic therapy is going on. So it is very important to finish the course. Okay, IV infusion is only possible, IV infusion and close monitoring is only possible in a hospital. Okay, our expert medical team, doctors, nurses are here to monitor you, will be able to act accordingly if you experiences any discomfort. So now you will be getting only discharge once the infection gets controlled. So for that, IV infusion has to be continued. So for that, IV infusion has to be continued. Okay. After that, once it gets controlled, once the IV infusion is over, you will be switched on to oral antibiotics. Okay, you will be switched on to oral antibiotics. Fine. And after that, you can establish a self-medication routine. You can give the question. Okay, after that you can establish a self-medication routine. After that you can establish a self-medication routine. Okay, once after this oral tablet, once after this So once after that, once after oral medication, once oral medication starts, you can establish a self-medication routine. You can take the medications by self. Okay, you can establish a self-medication routine, or you can take medications by self. Okay, then only you can expect a discharge. Okay, till then your health is at priority. You have to continue a stay here. Okay, your health is at priority, and you have to stay here. Okay, don't worry. You'll be definitely having a speedy recovery. Don't worry, you'll be definitely having a speedy recovery. We are just motivating the patient. Okay. So what about my, so the patient will be asking like, what about my treatment plan, nurse? How long do I need to continue this antibiotic treatment? What is the plan, nurse? Can you please tell me? Surely I will explain you. I could explain you. Surely I will explain you. See, IV infusion, intravenous infusion of antibiotics will be continued for a few more days. See, intravenous infusion of medications will be continued for a few more days. Okay, after that you will be given 4 to 6 oral antibiotics course at home. After that you will be given 4 to 6 weeks antibiotic course at home. Okay, I want to tell you one thing. Never skip the dose, never miss any of your medication. It is indeed very important to finish the antibiotic course for a complete recovery. Okay, so that sentence you need to state to the patient. Okay, so one thing I want to tell you, never miss the school, never miss the course, never skip the dose. You need to continue the medication for entire day to have a complete recovery. Okay, otherwise it could have some deleterious effect on your health. Otherwise it could have some deleterious effect on your health. Okay, so make sure that you are continuing the antibiotic course. Okay, so we have just taken, so IV intravenous infusion will be given through a few more days. It will be continued for a few more days. After that 4 to 6 weeks antibiotic course will be, oral antibiotic course will be there at home. At home you can establish, you can take some medication by self, but never miss the dose, never skip the dose. Okay, never skip the medication. It is very important to complete the course to have a complete recovery. Otherwise it could have some deleterious effect on your health. Okay, so please do that. So will you be, I hope you will definitely do that. Okay, so the patient will be saying like, no, sure, I will definitely do that. Glad to hear that. Okay, glad to hear that. So this, if you'll be having a complete, a faster, safe recovery if you adhere to the instructions outlined. Okay, Patrick, if you adhere, you can definitely expect to have a speedy recovery. You can definitely expect to have a speedy recovery if you adhere to the instructions outlined. If you adhere to the instructions outlined. Okay, hope you will do that. Hope you will do that. Sure. Great. Well, yes, any more concerns? Anything more to explain? Do you have any other queries, questions or concerns? Okay, concerns for me. Is there anything else bothering you? Okay, do you wish to discuss anything more? Is there anything else that you would like to ask or discuss? Anything you can. The patient will be saying like, no nurse, thank you so much. Now it's more clear, nurse, thank you so much. Okay, don't worry, more instructions and information will be given at the time of discharge, and you can feel free to contact us at any time. We are here to help, and feel free to contact us at any time. We are here to help. Fine. patient. Thank you, nurse. Thank you. Well, thank you for your patient listening. Now, shall I proceed with my clinical checks? Okay. Now, shall I proceed with my clinical checks? Are you okay? Shall I proceed with my clinical checks? Are you okay? Patient will be saying like, yes, nurse, you may continue. Thank you. Thank you, Mr. Patrick. You please feel comfortable. Stay relaxed. I'll start. Okay, now you please feel comfortable. Stay relaxed. That's enough. Okay. Okay, thank you. Thank you, Mr. Patrick. Now you feel comfortable. Relax. Now you please feel comfortable. Stay relaxed or relax. Okay, now you please feel comfortable. Now you feel comfortable. Relax. Now you feel comfortable. Relax. That's all. So it's a perfect a natural introduction and conclusion we have done through. Hope all my dear students, it was clear to all my dear students. Just watch the video, take the dialogue, see the intonation, the organization, everything you can take. You can take it as a reference for your practice. Okay, so more and more sessions will be following. I hope all my dear students are making use of it. Make use of it, learn well, study well, get your OET course. Okay, get your OET course, get your OET results. Fly to your dream destinations. Okay, so prayers and wishes from B-GHUD family. Stay tuned. 32nd session will be there on next Friday. Till then, take care. Bye.